Good morning, YouTube. This morning I am going to discuss mental illness and addiction, and whether addiction is actually a mental illness or not. I myself, as I've mentioned in the past, I am a recovering addict and alcoholic. I've been clean now for about 18 months. Before that, I was clean for about 7 years, and I had a 2 month relapse where I kind of fell off the wagon, went off the beaten path. But I managed to get it back in control myself without having to go away to rehab or anything like that. Even though that's what my family wanted me to do, I disagreed and did as I've done in the past. Just made up my mind and used my willpower and my belief in self and took care of business. You know what I'm saying? Addiction as a mental illness. I personally believe addiction is a mental illness. I think a lot of people who are addicts are also, dual diagnosis. That a lot of them have an underlying mental illness or some underlying issues that their substance abuse initially was trying to either mask or self-medicate, and then the substance abuse got out of control, and in turn they end up in the throes of addiction. I myself, I started at a young age. I think I was like 10 or 11 when I first smoked pot and drank, and it went on from there. I was in rehab when I was 15 for cocaine too. That's the only time I've been to rehab, but I've basically, used drugs pretty much my whole life from when I was 10 till when I was about 34, 33. And, as I mentioned in my other videos, I'm very tolerant to drugs, not only medications, but also illicit drugs. So when I used to do drugs, believe me. I mean, I wouldn't go out and buy myself a gram of cocaine. I would go out and buy a half ounce. I wouldn't buy, a bundle of heroin. I would buy 7 or 8, and, I was a mess when I was pretty much at the peak of my addiction. I was doing a lot of, when I was younger, I was big into cocaine. And as I got older, I got big into opiates. And, a lot of that was due to pain management and, injuries that I had to my back and my leg. And, trying to self-medicate that. And also with the mental illness, too. It makes, if you can make yourself numb and dumb, you don't experience it as much. Experience the, the feelings of the mental illness as much. Another thing with addiction, like I said, a lot of people with mental illness use substances to self-medicate. Then in turn, they become addicted to these substances. One point that you can take is schizophrenics and nicotine. People with schizospectrum disorders all tend to be cigarettes. Well, most, not all, but I'd say probably 65% tend to be cigarette smokers and heavy smokers. Because, it's proven that it's a proven fact that, well, not a proven fact, but nicotine helps to relieve the symptoms of schizophrenia, and it also helps to ease the side effects of the medication. So you'll notice, most of your schizophrenic people, schizospectrum people, are heavy smokers. And I've noticed that to be true in my therapy group and everything else. Everybody is a pack plus a day smoker. I myself, I smoke probably a pack and a half a day. I mean, if you watch my videos or anything else, watch my gaming videos or watch me stream on Twitch, you'll see I always have a cigarette in my mouth. So another reason I believe addiction and mental illness are related, or addiction is a mental illness, is because they both act on similar neurotransmitters, especially dopamine, which is kind of what our body uses to give us a feeling of euphoria, a feeling of makes you feel good. It's the feel good neurotransmitter, and both people with mental illness a lot of times have problems where they don't produce enough dopamine, or they don't have enough dopamine, or they don't react properly to dopamine, and therefore they don't experience the feelings of happiness and euphoria, and the feel good, warm and fuzzy feeling, and they look to drugs and alcohol to produce that effect, which it often does. As far as genetics go, I think I happen to believe myself. Some people may argue this different. I'm not sure medically or scientifically what the overall theory is, but I think that both addiction and mental illness are both genetic. They're both very strongly related to your genetics. Myself, for example, I have a history of of addiction in my family. Not necessarily, we're not all stark raving crackheads, but alcohol is a big thing in my family. I have relatives who are no longer with us, and relatives that are still with us, most of whom no longer drink or use drugs, because we've all run the gauntlet of that through our lives, and nothing good has come of it, basically. But so there is a history there. I also, as far as the mental illness thing goes, I'm probably the only one in my family who I know of who's been to a psychiatrist and a psychologist, and actually been diagnosed, and actually had to be hospitalized and stuff like that. But I definitely have people that I'm related to, members of my family, who are definitely could definitely use a little bit of help. Again, a big thing is so sociopathy, psychopathy runs deep. I can name 3 or 4 people off the top of my head that I'm related to that are definitely exhibit the the same symptoms as I do. But unfortunately, they've never gotten treated, or used to at a time. Now as they've gotten older, they've kind of mellowed out, and they're not quite as extreme as they used to be. But I definitely have and bipolar as well. I have I can name at least 2 cousins that probably have bipolar, but I've never been checked out for it. So basically, addiction. I think mentally ill people are definitely more susceptible to it. Not only because of their desire to self-medicate, but also their lack of the ability to make proper decisions at times, and to control their impulses. And it's when you're have a mental illness, and you have a hard time with impulse control, and kind of doing the right thing. You kind of throw caution to the wind, and you're like, I want to get high, so I'm going to get high. Not the normal person think, well, maybe it would be nice to party a little bit, but I have to go to work in the morning. I really can't afford it. It's not the right thing to do, so I'm not going to do it. The mentally ill person is just willy-nilly into the wind, blazing it up, going nuts, go sick, go for broke, But, I think it is possible to beat addiction. I feel right now I'm at a point in my life where I'm not going to lie to you and say that I don't still have feelings and cravings. But they don't last long, and they come less and less often. I'm not going to lie to you, I miss heroin every day, but I don't miss it to the point where I feel the need to do it, if that makes any sense. I have the willpower, and I know it's a dead-end street. I know if I go back again, it's probably going to kill me, plain and simple, and I ain't ready to die quite yet. So anyway, to wrap this up, I do believe, in my opinion, again, this is my personal opinion, I'm not a doctor or medical professional, so don't take it with a grain of salt, if you will. I have done some research, though, and feel that I do kind of know what I'm talking about to a point. But I do feel that addiction is a mental illness. I think it should be treated as such. Unfortunately, a lot of times addiction in this country leads to the criminal justice system where it's not properly treated, it's not properly handled, and offenders go out and reoffend because they're technically still junkies when they leave. They haven't had the proper therapy and counseling and work throughs. It's just they basically go into a non-using stasis when they're in jail, or some of them use drugs in jail. You'd be surprised how easy it is to get drugs in jail. And this is getting kind of long, so I'm going to wrap it up. But again, I do think addiction is a mental illness and needs to be treated as such if it's going to be dealt with effectively. So if you are suffering from addiction, be it a lighter, we'll call it a lighter addiction, to say tobacco products, nicotine or cigarettes, chewing tobacco, things like that. Or, be it a, those are actually more easily dealt with. You can deal with those with over-the-counter. Nicorette is very good, works very well. I've used it in the past. You can get, now there's Chantix you can get from your doctor, but if you have any kind of mental illness or history of mental illness, they probably won't prescribe you Chantix because it's like Ambien. It can make some people go off the wall when they take it. So if you do have a mental illness history, you're probably not going to get a Chantix prescription, which is too bad because I hear it's wondrous. And if if you have a more difficult more difficult addiction, to narcotics or alcohol, especially alcohol and benzodiazepines. If you have a benzodiazepine or an alcohol addiction, please do not quit cold turkey. You need to go to a hospital. You need to be in a detox center because the detox from those two substances can kill you. Okay, it can literally kill you. You need to be under medical supervision and detox properly. Heroin, cocaine detox, that's going to make you wish you were dead for a couple of weeks, but it won't take you out. Usually. I suppose it could, but it's not listed under the, critical things, But again, alcohol and benzos do it in a medical atmosphere where you can get the, the proper things that you need so you don't have a seizure and fry your brain and die. I think that about sums it up. I hope everybody is having a good week. If anybody out there watching won Powerball, power to you. I guess 3 people won. Not a bad haul. Well, I can tell you, my family, we're not one of the 3, so I guess we'll play again next week. But anyway, everybody have a good day. Keep on trucking. If there is hope. Again, if you are experiencing symptoms of mental illness or depression, please seek help. There's help out there. It can be taken care of. You're not alone. You don't need to suffer. Anyway, until we meet again, this is Trug out. I'll talk to y'all later. Have a good day.